Hello and welcome, everyone. We want to welcome you to WIT4LIFE, where we help individuals to control the anger management, and resolving conflicts. Again, WIT4LIFE is more than just a anger management conflict resolution tool. It's a movement. And so we're so excited tonight that we have a special guest and with us who will be sharing some valuable information, impactful information, and you will be definitely um, educated on the topic that we're about to bring to you. Now, what I want to do is to make sure that you all, those who are joining us, want to make sure that you uh, turn off all social media channels so that you won't miss anything. Um, if there's any distraction in your background, for those attending us, attending the podcast, again, just make sure that you once again um, are able to focus and to tune in, take copious notes with us once again, because we have a young lady here that is going to bring us some powerful information on a topic that you may or may not know about. All right. And so with that said, I want to welcome our guest for tonight, Dr. Shambra Mulder. How you doing, Dr. Mulder?
I'm great. Thank you for having me.
Awesome. Well, thank you for joining us. We know that you could be anywhere right now, Dr. Mulder. Just kicking back and relaxing. I heard that this week is actually what fall break for the university.
Yes,
Is that correct? And so,
for the student.
really, I want to express my gratitude and appreciation for you um, taking this moment out to talk to our people about the very important topic tonight. But before I do that, I want to give you a formal introduction and let people know who you are, your background, and your specialty as well.
Okay.
Dr. Shambra Mulder is a licensed psychologist who is nationally certified in trauma focused cognitive behavior therapy, an effective evidence based treatment for treating youth with complex trauma. Her decades, decades of experience spans from founder of a private clinical practice and a nonprofit organization, deputy commissioner for the Department of for Behavior Health, Developmental, and Intellectual Disabilities with Kentucky Cabinet for Health and Family Services. Uh, 2023 to 2024, Robert Wood Johnson Foundation Health Policy Fellow with the National Academy of Medicine, current member of the Kentucky Psychological Association, serving on the Ethics Committee, U.S. Navy veteran, and much more. Dr. Mulder earned her advanced certification for Director of Special Education, a Master's of Science in Educational Psychology, and Educational Specialist degree in School Psychology, and a PhD in Educational Psychology from the University of Kentucky, as well as an advanced certificate in psychotherapy from Bellarmine University. She most recently completed the Executive Leadership in Healthcare certificate with the Harvard T.H. Chan School of Public Health. She is currently serving as Associate Professor, Chairperson of the School of Psychology at the at Kentucky State University within the College of Arts and Sciences. And I'll say woohoo for that because I'm a Kentucky State University alumni as well. So thank you. And so we um, uh, congratulate you on all of the um, accomplishments that you've had thus far. And we know the best is yet to come as well. So I'm going to go ahead and just ask you from the start. So tell us something about you that we don't know about, and something that was not mentioned, and something that our audience would benefit from.
Well, you didn't mention this, but many people know this that I'm an advocate. I was the education chair for the local NAACP chapter. And so
Okay.
I spent a lot of time talking about what goes on in school. And it goes back to my background as a school psychologist working in public schools, but looking at those kids who don't do well in our public schools and the achievement gaps that they have. And so it was a great honor to sort of communicate the gaps to our community to get more involved in what's going on in our schools, from special education to the discipline practices in our schools. All of this affects the sort of prison school to prison pipeline, and just doesn't sit well with me as someone who worked with children, and it's the next generation. And so I was very proud of that work. I haven't
Mhm.
done a lot of that here lately, but I try to advocate in the community as much as I can, and just educate people about what's really going on in our schools.
Okay. Awesome. And so tell us a little about our topic tonight, developing emotional intelligence.
Well, one of the things I think is something that people might take for granted is the ability to develop something. You're not born with it. It's something that you're taught. It's something that's modeled. It's a skill. It is something that we can work on and we will need to continue to work on. And I think emotional intelligence and moral reasoning are two things that I think affect people, and probably, again, where we have a lot of our school to prison pipeline is happening because children are not learning how to manage their emotions and to make good decisions. So if you think of emotional intelligence as like an IQ score, your cognitive intelligence, emotional intelligence is your ability to use your emotions for good, I guess.
Okay. Awesome. Great. Is emotional intelligence, is this something that professionals in your area utilize when it comes to conflict resolution, and how so? And how, well, let me ask that question first.
Okay, well, so emotional intelligence is your ability to understand and manage and use your emotions, recognize the emotions of other people, and we always talk about in mental health. You're never, cured or resolved it. You're just regulating and managing at all times. So you're taking in information. So anytime you're in a conflict, you have to take the other person in consideration, and if your goal is to resolve the conflict, it's going to be very helpful that you use your emotional intelligence well.
Okay. When it comes to, say, for instance, the professionals out there who are looking for new ways or innovative ways, let me put it that way, to handle um, whether youth or even adults who have difficulty with their anger. How does emotional um, intelligence weigh in, and how is it utilized?
Well, I think that you would probably agree, if we're going to resolve a conflict, it is best that we manage our emotions. Not that we don't have them, but how can we use it to de escalate and to resolve the conflict? And so, part of the skills that make you, I think, be able to do that, and also just a great skill to have in life, is self awareness, self regulation, empathy for others, and great social skills. Now, when we're in leadership positions or in general, we know that everybody doesn't come to it in the same place. Everybody's not where you might be. And so you're constantly saying, okay, how can I manage this? How can I manage this situation? How can I manage this? Because unfortunately, we can't live in a box. We have to interact with other people. We are humans. We have all kinds of emotions. So one of the things that's important is that I think as people, we recognize anger and maybe about three or four emotions, but there's a lot of emotions that we have that we don't communicate. So it comes out as anger, it comes out as sadness, but what we really are is disappointed, or we're guilty, or we feel shame. And so if we can communicate our emotions better to ourselves, we can give ourselves more grace, we can give other people more grace. And so it is just something that we have to constantly deal with as we deal with other people.
Okay, awesome. When you first mentioned to me about emotional intelligence, um, I thought it was very interesting, to say the least, and I thought it was a, a great tool in terms of how one may be able to approach, behavior modification.
Mhm.
Um, and I'm not sure I heard it or not. Um, but who was the founder of emotional intelligence? Or is there a founder of emotional intelligence, and how did it come to the forefront to be used within the area of cognitive behavior modification?
Well, I'm not quite sure who coined the term. I think that the concept is probably not new, but I'm not sure. But it is a curriculum that's taught in our schools. It is part of helping children manage their
Hmm.
behavior. And so I'm not sure who coined the term, probably along with cognitive intelligence became, okay, so someone can be very cognitively, but the emotional maturity comes with time modeling and all. So there's probably a lot of theories that come into play in terms of emotional intelligence, but I'm not sure who's the founder per se. But we can all go back to the Bible.
Okay.
And so I think a lot of things go back to the Bible. When we think about emotional intelligence, we think about the fruit of the spirit. If
Yeah.
you're able to do all of those things, you're probably going to be able to manage your emotions and have less conflict.
That's that's kind of awesome. You mentioned that, and uh, whether people believe this or not, but my pastor, believe it or not, has just started a series on the fruit of the spirit.
And there's also a great, I don't know if you've ever heard of this Bible study called Master Life.
What is his name?
Master Life,
Master Light
Life, Master
Light.
Life. And so
Master Life. Yes, yes.
that whole series is about emotional intelligence. How can we use our emotions, our bodies, and our life to master this life? So yeah, so I've done that series before.
Oh, wow. So here we have, again, my pastor, Bishop Stephen Lyons at Grove Temple. He just started the series last week. And believe it or not, one of my mentors for years, when I first came to Kentucky State University, um, he had a chance to catch up with him after all of these years. And I don't know if you know him or not, but his name is Stefan Gilkey. But believe it or not, he mentioned Master Life to me this
Mhm.
past weekend during the home. Yeah, so it's amazing how things come together, and you never know the connections that God brings to you, why He's bringing to you. But I believe, Dr. Mulder, that's like a confirmation,
It is an
if I
awesome
may say.
study, and it goes back to this whole thing, because people who's in our culture keep it real, and we say that's just me, that's just the way I am, as in to
Right.
say they can't change or they can't do it better, especially if it's not working for them.
Hmm.
So,
That
our
is awesome.
behavior is
So,
just a manifestation of where we are in our emotional intelligence. It will show up because there's going to be things that's going to try us and get us off kilter. And, all of us are human. Like, the kids call it crashing out. So when you crash out and you come back and you're going, why did I do that?
yeah,
There was a trigger or something. I don't know. I thought I had passed that and I wasn't, but things
right.
us. And an important thing is that when you have emotional intelligence, you learn from that and you say, okay, what could I have done differently? Why did that trigger me? Why did what someone say bother me? There's a reason, and that's okay. And so the idea would be, in order to grow, you have to look at those things and figure out, okay, that did not work. Um, that emotion that I had was probably extreme and not does not fit the situation. And so we all want to live, my company called abundant living because I believe that we're all supposed to live in abundance. And that's abundance of resources, abundance in happiness, abundance in everything. That's what's
Right.
for us. All good things are intended for us. And so the question would be, where did we go wrong, or what happened to where we're not living in abundance? That's where therapy comes in, or at least
I
my
love, yes, I love it when you said, about the abundance,
Mhm.
that we're supposed to be living in abundance. And as a matter of fact, was the scripture from John 10 says that the thief cometh but not for to steal, kill, and destroy. And then it goes on to say, and I am come that they might have life and life more abundantly. Of course, that was Jesus speaking. And so we are to have an abundant life. And is no coincidence, you all, that Dr. Mulder's her organization, and I'm going to put this up here for just briefly, so you all can see the name of her organization, um, which is called. Hopefully, y'all can see that. It's called Abundant Living Psychological and Coaching Services. And so her services, again, um, it has the pivotal name that is Abundant Living. And along with that, I wanted to say um, along with that name, my institute is called Total Abundance Institute. So when I talked to initially, or some of you don't know, I've known Dr. Mulder for many years, rounded about, um, but when I asked her if she would be willing to speak on my podcast, I had no idea again that she had this organization, Abundant Living Psychological and Coaching Services. And so, going back to again developing emotional intelligence, would you? And this may be a sound facetious, I don't know, but would emotional intelligence help with um, our urban youth or urban children, and how can we use emotional intelligence to relate to our people, and that is our African Americans?
Okay. Well, of course, it helps with all people. I just think
Sure.
when you're in an urban area, you're dealing with a lot of stressors that other people may not have, which will hinder you from maybe being your best self. And so I do believe that the situation calls for something unique for people who, because poverty is traumatic, right? It is lack. And if you go back to psychology and Maslow hierarchical learning,
Hmm.
if you're not able to deal with the lower levels of food, shelter, and to get to the highest level of self actualization, you're not going to be able to reach that if your basic needs are being
Mm-hmm.
met. And so I think that's where, economic things are necessary. It's kind of like if I'm dealing with, I can't put food on the table, I don't have gas, and you're asking me about, I don't know, love. I'm
Right.
like,
Right. Right.
I'm just trying to survive, right? So we're moving from surviving to thriving, but it's hard to do that. And so when we deal with urban, and we deal with trauma, and I don't know if you're familiar with the adverse childhood experiences and the
Mm.
10 traumas that affect people in childhood that will affect them in adulthood. those 10 traumas have been studied over and over for years, but there's other traumas that are not there. And so I define a trauma as anything that happens to you that changed the way you look at yourself, the way you look at others, the way you see the world, the way you experience the world going forward could be traumatic. And so that's individualized, right? But we do know there are people who are constantly living with death, um, um, poverty in terms of not able to meet their basic needs. And so, outside of all of those things that urban youth are dealing with, we're dealing with, um, and I don't know how this is going to come across, but when you're in those situations, you have limited experiences, you're dealing with other people with limited experiences, you don't have the right models to show you what else it could be. You know what I mean? Like if you've only lived here and you've only seen this, it's hard for you to imagine the other side. And so I think when we're all dealing with the same stressors, it's very difficult to imagine a time where, this is the way my parents handle things, this is the way my brothers handle things, this is the way they did. And that is now almost the way I'm supposed to do it or the only way to do it. And so I think if I think of the work that I've done with children, I say children, in the juvenile detention center, there's two things. There's a lack of respect for authority,
Mm-hmm.
and then the emotional intelligence. And all of that comes from modeling or the lack of modeling and mentoring, I think. And so if we look at trauma in its entirety, the middle of it is shame, right? So we feel shame when we don't have something because we see other people have it. So we have to make a moral decision. Do we what are we willing to do to get that?
Mm-hmm.
Because
Mm-hmm.
it's only natural to want it, right? You don't want
Right.
to be in you don't want to be living in this situation. So again, we just in urban areas, I think we're putting people in situations where they don't believe that they have a lot of choices. They don't have a lot of models to show them other ways of behaving or other ways to do things. And we're just dealing with trauma. Um, and so I've worked with young people who are struggling in school, and I remember, and I'm working with girls who are people think girls that don't have the same issues, but there one girl said to me, and she's a middle schooler, I don't I don't care if I live. Um, Almost I don't expect to live long. If you think
Mm.
about young people, I don't expect to live to 21. Very few people I
Wow.
live to 21. And so if you have that mindset, then you probably don't care about what you do to your bodies and your body, let alone someone else's body, right? And so it shows a lack of love and respect that they haven't gotten and that they're putting out in the world. And then you just have access to things. If you have access to drugs, you have access to weapons. Those are just used for people who are hurting.
Mm.
Because people will say guns don't kill, people do. That's true. But you have people who are in impossible situation having access to guns. So, it works both ways,
Right.
and for me, I don't know if we get to the root of things a lot of times, and I know a lot of therapy, when you said trauma-focused cognitive behavioral therapy, that is a type of therapy that's very structured and probably teaches skills and how to change your thinking and your behavior. But really, when I'm dealing with adults and working with adults, you have to get to the root of things. And a lot of therapists do not get to the root. We don't go back to when was the first time you felt this way? What was going on? And then when I see a lot of African American people, so we deal with religious trauma, we deal with generational trauma, we deal with the thinking, and in fact trauma that goes on in schools and all things like that. So I don't know if we're dealing with the root of the problem, and if we can deal with the root of the problem. One of the things, if in doing therapy, we do what we call motivational interviewing, and we have to decide where is this person in their belief that they can change, because you can't do
Hmm.
it, right? I'm just here as to help you process, maybe look at it differently, talk about it differently, give you some skills, but I really can't do the work, right? You're here for an hour, you're living the rest of the time, and so I can't do it for you. But if you're not ready to do it, I'm going to continue to do my part to get you ready as long as you continue to come see me. But if you choose not to come see me, and not to say that I'm the person that does anything, I was sounding a little arrogant there. I'm not. Well, I'll just bring it back to scripture. Some water, some plant, some reap. Right. I'm just here as a vessel and to help you if you want the help. Um, I have some training, of course, I have some experiences to share, but really I believe I would not do this work if I didn't believe that people can change. If I didn't believe that people deserve to live abundantly. And if I can convince people of that, that would be my life's work.
Hmm. That's
So
great.
back to emotional intelligence, I think I went off maybe. Emotional
No,
intelligence.
that's good. That's good. That's
Think
good.
that our young people are accustomed to, like I said, anger, maybe sadness, maybe fear, and need to learn how to communicate better, and how to express their other emotions that in a very healthy way. And I talked to you, about, there's a book called Post Traumatic Slave Syndrome,
Hmm.
and there's a psychologist that wrote that, and she talked about the effects of slavery, and
Hmm.
three of the things that we sort of adopted as a result of slavery. I think is very, we have this. She called it vacant esteem, which is kind of like a numbness about it, and we've been oppressed every day from microaggressions, all kinds of things racism brings to itself, and it puts you in a position of maybe being a little hopeless. And I know we're in that state for a lot of reasons today, but we also have like a propensity for anger and violence, and it's not because we were born that way. It's
Hmm.
just that sometimes when things are coming at you, that one time could be the time where you might do something that you normally won't do. It's just piled on. And I think that, where you work in prisons, there are people who made the wrong decision one time. It's not something that they naturally do, but something happened at this particular time, and they end up doing something that is not characteristic of themselves. But then also, we also have internalized some of the things that have been said about us, or and it is something that we kind of gloss over. But even in psychology, the American Psychological Association, back when George Floyd and the racial reckoning was coming, apologized for the field of psychology contributing to some of the racist ideas we have about African American people.
Hmm.
And so when we talk about um, stigma in mental health and not wanting to
Right.
get help, those are real things. This is just not, oh, they just don't want to get help. You have to have psychological safety, you have to trust, you have some people want therapists that look like them, and that is hard to find. uh and that is okay. It is actually been proven that that makes that experience better. And so it's easy to say people just need therapy, they need to just go to therapy. Well, that's more than a notion. It's not the easiest thing to find someone, and it's not the easiest thing to come in the door. And there are people who walked in the therapist's office and that have been um not treated well. So um it and the reason why I do the work that I'm doing now as opposed to doing individual therapy is that I can't see everybody. So how can I support lawmakers and public policy at the university and producing people that can work with more people? What can I do to affect the larger population, because we'll never be able to meet the needs, because we as a country are doing a great job of traumatizing people and hurting people and putting people in situations. So we'll never have enough therapists to go around. So we need to do things like this where we're teaching the public some things that they can do. Everybody, again, everybody doesn't need a therapist. It would be helpful. Everybody's not going to get a therapist. Everybody doesn't need to be hospitalized. Everybody doesn't need medication. But all of us need to be armed with some basic information to help people, help ourselves, and help other people. And I'll just throw this shameless plug in, because it's not because it'll benefit me personally, but I don't know if you're familiar with the coloring book that I did through my nonprofit organization, which is called Professional Life Coach. And so through my nonprofit, I was on a call during COVID, and they were talking, the health department was talking about how children were suffering in during COVID online and all of those things. And I said out loud, I said, somebody should do a coloring book to help adults speak to very small children about mental health topics. And of course, I was convicted, and I was like, okay, maybe that somebody's me.
Hmm.
And so what we did in my nonprofit is we created a coloring book, and that coloring book has a coloring page on one side to kind of help small children, but I've seen it work with college students because they like to color as well. And then on the back of the page, it talks about a mental health topic that is, I think, close to that age group, and what people can do, even if it's an older sibling, read that information and talk about it in a very general term. But I think what you'll learn a lot about mental health, and they'll learn a lot, but you
Hmm.
might recognize some things that you didn't know about the child, maybe some things that make you believe that they need a professional. But at least you're having conversations very early on about mental health at the kitchen table, like
That's
it's
good.
natural, everyday kind of talk. And so that coloring book has done well for us. Of course, the funding goes to the nonprofit, and we're able to give the book away at community fairs by people purchasing the book on Amazon.com. But I want to do another one, and I know what I want to do it on. I'm just kind of like procrastinating.
Hmm.
I have the illustration. My nonprofit is African American women, and it's about women and families. But the girl that did the drawings was a high school student, and she has already done the drawings for the next one. I don't know, in my head about it. I think the first time I did it, I had a clear idea, and then of course I made it more complicated. But I say that to say emotional intelligence and mental health and the ability to manage that starts really early. And it should start with the information, and then the modeling, and then practicing and learning from practicing. Okay, I could have done that differently. Let me try it. The next time I'll do it differently. Of course, we know sometimes we do it the same way the next time. So it just takes practice.
Hmm.
Yeah.
Wow, that was very informative and impactful too. One of the things that touched me, I believe, was the coloring book. Um, yeah, the population that I work with, um, some of you may not know, within the incarceration, there a lot of times there are tools that we need to bring to them that can help them process the trauma, the PTSD. A lot of times we don't realize what people have gone through in
Mhm.
their past, that people just like you and I, and for one thing or another, like you were saying earlier, um, a trigger may have caused them to go off or whatever, and before you know it, they find themselves in trouble.
Right.
And I believe that, having tools like what you're saying, your coloring book, I want to get a copy, by the way, to process these particular emotions and experience, I think is important, and to be able to process it in a non quote unquote therapeutic setting, makes them relax, brings them back to maybe um, childhood setting or mindset, or just to have them to simply open up. And
Mhm.
so I think, once again, I think that's a very valuable tool that
Well, what
you
you
all are
said
using.
reminds
And
me, in trauma work, when we see people who are struggling, we instead of saying what's wrong with them, we say what's happened to them.
what's happened to them?
Mhm.
Okay.
Yeah, instead of what's wrong with them, because I liken it to maybe a 2-year-old. Um, 2-year-olds are usually happy. Life is good. Things go,
Hmm.
going their way, and then something happens, right? We're not like the child anymore. The innocence is not there anymore. The trust is not there anymore. So, you know, we want to know what's happened. That's not what it was intended for your life, for you to be on drugs. I don't know anybody that says I want to grow up and be a drug addict.
Awesome. Well, I want to, before we, I guess, end tonight, I would love for you to share with the people how they can get in touch with you. I'll, of course, post your information, brief information, but there's some other things that maybe you would like to share with us, what's going on and how they can get in touch with you, particular events maybe that you'll be at.
Mhm.
So would you like to share that before I post
Well, of course, I
your
have my
info?
website. I'm not taking clients for therapy. I feel like I have 5 jobs now.
Hmm.
What I'm focusing on right now is my work at Kentucky State. Like I said, I started a counseling program, a forensic counseling program, and I want more students to come through and become clinicians. And so I'm excited about that. And I'm excited about being at Kentucky State. I think at this time, this is a great place for me to feed into our young people that look like me. And so I'm excited about the opportunities at Kentucky State.
Hmm.
And I do some things, contracted work that's really not public facing. But I'm also available to do things like this because this is like something I'm, love to do. But there's not a lot of sort of therapy I do. I do assessments. I do assessments for the disability office. So I do see people for that reason. But who knows? I there might be a time where I might be able to do therapy. I do love working with young people. For the most part, I do adults as well, but you know, for now, I think I'm going to just continue to focus on my work at Kentucky State and then do a few things on the side that I can do that's not very, that doesn't require a big commitment.
Let me ask you a question. With your services, do you ever do any group sessions?
I have not, um, not typically. I'm usually one on one.
Okay. That would, within the circle that I work with, that would be something great, that's ever, if ever approved, that I think would be very beneficial to a
Yeah,
group.
I have things that I do one off kind of a thing as opposed to a consistent therapy client. One of the things that is great that we have what we call a psych pact, which is a legislation that says that you can do telehealth in every state that has signed on to the pact. And so by being licensed in Kentucky, I can actually see people in about 48 states doing telehealth. But I just have not taken haven't done a lot of advertising and doing that kind of work. And one of the things that also that probably hinders people from my services is that I don't take insurance. And I know that people use insurance. I know that a lot of people have Medicaid, and I'm just not doing that right now. The paperwork is just not what I want to be doing right now.
Hmm.
And so
I understand.
at this time, I could see how that could be a hindrance. And so right now, I just, I was, like you said, I was in DC and I came back in the late 2024, took this role. And so, you know, there's ebbs and flows. Maybe at some point I'll get back to doing individual therapy.
Okay. Awesome. Well, I am, once again, I'm so excited, Dr. Mulder, that once again that you have taken the time to be on our podcast, Wit for Life podcast. And not only that, but I'm so excited that you joined the staff at Kentucky State University. Um, that brings my heart to joy, and so I'm so excited about that, and I'm sure that students will benefit greatly from the knowledge and just your let me say this, your personality. Ever since I've known you, you've always had a smile on your face. You know what I'm saying? And that speaks volumes of the spirit that's in you, the joy that's
Mhm.
in you. And so, you know, a lot of time, well, yeah, it's not just intellectual, but that spirit. You have that spirit of joy, that of compassion is what I want to say, and that can reach a whole lot of people. Sometimes what I wanted to say, I don't want to be negative, but sometimes um, people feel a little intimidated by others who may have doctor degrees or therapists or psychologists or whatever, psychiatrists, and simply because they don't know if they should approach them. They may not smile as much, or they may appear to be so serious. But once again, I appreciate you and who you are, your character, and once again, and all that you do for our community as well.
I thank you
And
for
so
the
I'm going to post
you
this
do.
again for those who are just joining us. Go ahead and take a snapshot if you would. Um, on the right side, you'll see the information. Uh, again, uh, Dr. Shambra Mulder, the name of her organization, services, shall I say, is Abundant Living Psychological and Coaching Services. And at the bottom there, if you can see that, even scrolling at the bottom, it says Abundant Living Psychological and Coaching Services.com. Again, www.abundantlivingpsychological and coaching services.com. So again, we want to thank you all for joining us here. And again, we want to invite you to return back, same time, same place, next week, as we broadcast our Wit for Life podcast live here. And for some of you, um, so you understand, on the Facebook Live, um, it may not be able to view this live, but you will be seeing the recording. But we are live on our LinkedIn account and also on our Total Abundance Institute account. All right. So let me go back here, take this off of here, and all right, and that's it. And so, um, thank you once again, Dr. Mulder. Any last words before we dismiss? And I always like to dismiss with a word of prayer for you all who have joined us on this podcast. With everything that's going on, you all in our society, in our state, in our city, um, this podcast was created simply because we wanted to do something to um, try to reach those who uh, uh, need some more skills, strategies, coping skills, um, anger management, conflict resolution techniques, whatever it may be, so that they may not lash out at others in a violent way that, and sometimes end up taking lives. So that's why Wit for Life was created, for to help our people and help them come to that next level of resolving conflicts. All right. So, any last words?
Well, thank you for doing the work that you're doing and the work that you do professionally and with this podcast, being an African American male with the heart and the ability to do this kind of work is very valuable.
Thank you once again. All right, you all. Well, listen, thank you once again. Please make sure that you all share with this with someone. Visit again our YouTube channel, Total Abundance Institute YouTube channel, where you can actually see the replay of this particular podcast, as well as our Facebook channel and our LinkedIn channel. All right. Let us pray. Father, in the name of Jesus, we thank you for everything that has come before the people today, even those who will be watching the replay, that something that has been said that will inspire them or encourage them, Father, one way or another, either to make sound decisions or either to take the information and help others as well um, during those trying times of conflict. And so we just thank you for everything that you're doing. Continue to bless Dr. Mulder abundantly, Father, and we just thank you for everything that you've done. In Jesus' name, amen.
Amen.
All right. We'll see you later. Thank you, Dr. Moon.
Bye.
Bye bye.